Module 1, Introduction to Insomnia in Traditional Chinese Medicine. Welcome to the first lecture in this series on insomnia in traditional Chinese medicine. In this opening session, we will establish a foundational understanding of how insomnia is viewed within the classical medical framework, why it holds such importance in clinical practice, and how this ancient perspective continues to guide effective treatment today. In Western biomedicine, insomnia is commonly described as difficulty falling asleep, difficulty staying asleep, or experiencing non-restorative sleep. From the perspective of traditional Chinese medicine, however, insomnia is not simply a disorder of sleep itself. It is understood as a reflection of deeper disharmony within the mind-body system. The Huangdi Neijing teaches that when the heart is peaceful, sleep follows, and when the heart is disturbed, one cannot rest. Sleep arises naturally when yin and yang alternate in proper rhythm. When the body is active, outward yang energy withdraws inward and is embraced by yin. If this transition is disrupted, the spirit, the Shén, cannot settle. Wakefulness then persists, even when the body is exhausted. For this reason, insomnia in Chinese medicine is not treated as an isolated symptom. It is recognized as an expression of imbalance between movement and stillness, heat and coolness, excess and deficiency, most often involving the heart, liver, spleen, or kidney systems. In Chinese medicine, the heart is regarded as the ruler of all organs and the residence of the Shén. The Shén governs awareness, emotional regulation, and the capacity for restful sleep. When heart blood is sufficient and circulation is smooth, the Shén rests easily within its dwelling. Sleep becomes calm, and the mind is clear. When the heart is disturbed, whether by heat, deficiency, or emotional strain, the Shén becomes restless. This may manifest as difficulty falling asleep, frequent waking, or vivid and unsettling dreams. Heart-related insomnia may arise from heart blood deficiency, often due to worry or overwork, which leaves the Shén without adequate nourishment. It may arise from heart yin deficiency, leading to internal heat and agitation. It may also arise from heart fire, in which emotional excess generates heat that drives the Shén upward and outward. Although these patterns differ, they share a common feature. The Shén is unable to find rest. While the heart governs the Shén, it does not function in isolation. The liver plays a critical role by storing blood and ensuring the smooth flow of qi. This influences emotional balance and supports the inward return of yang at night. When liver qi stagnates, often due to anger, frustration, or unexpressed emotion, heat may rise and disturb the Shén. This commonly produces difficulty falling asleep or waking between 1 and 3 in the morning, corresponding to the liver's time in the circadian cycle. The spleen and stomach are equally important. They generate the blood that nourishes the heart, and their transformation of food and thought provides the material foundation for the Shén. Overthinking, worry, or late-night eating can weaken spleen qi. Over time, this may lead to deficiency and the accumulation of phlegm. Phlegm clouds the sensory orifices and obstructs the heart, manifesting as insomnia accompanied by heaviness, mental fog, or vivid and disturbing dreams. The kidneys anchor yin and store essence. When kidney yin becomes deficient through aging, chronic stress, or overwork, the cooling and stabilizing aspect of the system weakens. Empty fire then rises toward the heart and agitates the Shén. Patients with this pattern often experience restless sleep, along with hot palms and soles or dryness of the throat. At the core of the classical understanding of sleep is the alternation of yin and yang. During the day, yang predominates, supporting activity and outward engagement. At night, yang withdraws inward and merges with yin, allowing rest and restoration. The Ling Shu states that when yang enters yin, the eyes close, and when yin and yang separate, the eyes open. Insomnia reflects a failure of this natural rhythm. In some cases, yang is excessively active and cannot return inward, resulting in agitation, anxiety, or an overactive mind. In other cases, yin is too weak to receive and contain yang, leading to light, fragmented sleep associated with chronic deficiency. In both situations, the therapeutic aim is to restore the dynamic alternation of yin and yang so that the body and spirit can once again move in harmony. Emotional strain is among the most common root causes of insomnia. Joy, anger, worry, grief, and fear each correspond to an organ system, and excess of any emotion disrupts the circulation of qi and blood. Over time, this creates patterns such as liver qi stagnation, spleen deficiency, or heart fire, all of which disturb the Shén. Anger and frustration constrain the liver and prevent yang from descending. Worry and overthinking weaken the spleen and deplete qi, leaving the heart insufficiently nourished. Grief affects the lungs and heart, tightening the chest and obstructing circulation. Fear depletes the kidneys and disrupts the essential communication between heart and kidney that supports emotional stability and restful sleep. The classics remind us that when emotions are excessive, the Shén becomes scattered. Treatment must therefore address not only the physical body, but also the patterns of tension held within the mind. Clinically, insomnia presents in several distinct ways. Some patients struggle to fall asleep, reflecting difficulty entering yin. Others experience light or fragmented sleep, indicating instability of the Shén. Some have dream-disturbed sleep, often associated with heat or phlegm. Early morning waking may suggest yin deficiency or residual heat. In severe cases, patients may be unable to sleep at all, reflecting extreme agitation from fire or phlegm heat. These manifestations guide the clinician in identifying whether the underlying pattern is primarily deficiency, excess, or a combination of both. In modern clinical practice, sleep disturbance is among the most common complaints seen by acupuncturists. It accompanies nearly every chronic condition, including pain syndromes, anxiety, depression, digestive disorders, and hormonal imbalance. Poor sleep directly influences healing outcomes and reduces overall resilience. From the perspective of Chinese medicine, when yin and yang cannot alternate, the natural restoration of qi and blood is compromised. Sleep is the time when the body repairs, the liver stores blood, and the Shén is renewed. Without adequate sleep, treatment effects are diminished and recovery becomes more difficult. Although this course remains grounded in classical theory, it is worth noting that modern research increasingly validates these traditional observations. Neurophysiological studies demonstrate that acupuncture and herbal medicine influence neurotransmitters such as serotonin, GABA, and melatonin. These mechanisms closely mirror the classical goal of calming the Shén and nourishing yin. In later lectures, we will explore this research in detail and examine how contemporary science supports the logic of Chinese medical theory. Over the course of this program, we will examine the etiological factors that create insomnia and disrupt the flow of qi and blood. We will explore the major diagnostic patterns and their distinguishing features, along with classical acupuncture prescriptions and their clinical adaptations. We will also review modern physiological research and clinical case studies, demonstrating how these principles are applied in practice. By the end of this course, you will have both a solid theoretical foundation and practical tools for treating insomnia in its many forms, rooted in tradition and refined through modern understanding. To study insomnia is to study the rhythm of life itself. Sleep is not merely the absence of wakefulness, it is the return of yang into yin and the settling of the spirit into stillness. When this rhythm falters, the individual loses connection with the restorative pulse of nature. As practitioners, our task is to reestablish this harmony by clearing heat, nourishing blood, calming the Shén, and guiding the patient back into alignment with the great alternation of Yin and Yang. In doing so, we restore not only sleep, but the quiet center from which clarity, vitality, and healing arise.